We know from Aristotle that Apixaban reduces the risk of stroke and systemic emboli in patients with AF and risk factors for stroke compared with warfarin. Now, a paper in the March 25th issue of JACC is looking at a slightly different analysis, the efficacy and safety of Apixaban in patients following cardioversion for atrial fibrillation. And this is insights from the Aristotle trial. I'm with the first author of the paper, Dr. Greg Flaker, professor of medicine at the University of Missouri. And I guess the first thing we should do is just remind us, what did we find in the overall Aristotle trial?
Overall, Aristotle, compared with warfarin, reduced the risk of stroke or systemic embolism by 21%. It also reduced overall mortality compared with warfarin by 11%. And major bleeding was reduced by 31%. So pretty compelling findings in the atrial fibrillation population as a whole.
Now, a lot of patients with AF end up going for a procedure that is cardioversion. Then the whole issue becomes a little bit different. So you're doing an analysis of patients from Aristotle who went on to cardioversion?
That's correct, Rick. We found about 753 cardioversion attempts. There were over 500 patients, so some had 2 or some had 3 cardioversions. And what we were interested in is what was the risk of a cardioversion in a Apixaban-treated patient compared with a warfarin-treated patient. We know historically that the risk of a stroke or systemic embolism after cardioversion is very low with warfarin treated. We wanted to see if that was also true with Apixaban.
What did you find?
Virtually no strokes or systemic embolism in the 30 days after cardioversion with Apixaban. And true to form, with warfarin, also a very low risk. So the risk of this are comparable and they're low.
Very good news. Any lessons that you want to take away from this?
A couple things. Number one is Apixaban was given generally for, I'd say, 6 months to 8 months. These are people that have been on Apixaban for some time. What we don't know from these data is what's the minimum length of time you can be on Apixaban before you have the cardioversion. That's the qualifier, I think, in this.
Are you going to be doing follow-up studies to try and see what the answer to that question is?
Great question. The event rate is so low that we'd have to have like an 18,000 or 20,000 patient study to find the answer to this. And I don't think that's feasible. Instead, we'll probably be looking at the studies that have taken some of these new agents and find out what the event rate is after the study drug is used. I think that's the way we're going to do it, and that'll work its way into the guidelines. I'm hopeful.
Yeah. So in terms of the bottom line message, it's one of optimism at this point. I mean, that's congratulations, because I really do think this is important information.
I think it's consistent with the other Aristotle information. It looks like this is a better anticoagulant than warfarin in so many aspects. And here we've got another indication for it, a cardioversion that's pretty common in atrial fib patients, and it looks like it's effective in that situation.
Well, the paper, again, is in the March 25th issue of JACC, and this is an analysis from the Aristotle trial. Please make sure you look up Dr. Flaker's paper and a variety of other things that we're talking about here. For CardioSource World News, I'm Executive Editor Rick McGuire.